Hi, I'm Ira. I'm here with Dr. Goh Yaw Chong. He is a specialist in upper gastrointestinal problems and general surgery. Dr. Goh, today we want to ask you more about abdominal pains because I've heard patients complain about pain in the upper stomach, in the lower part, in the left or right. So how do doctors actually decide, or the source of the problem is this organ?
In the abdomen, other than the muscles and the bones and the skin, the cavity actually contains three major systems.
Okay.
The digestive system, the urinary system, and the reproductive system.
Yes.
So therefore, each system with its organs would have symptoms which are actually indicative of the problems with the system. Where the pain might be felt by the patient, it need not point specifically to any particular organ. You're right. For example, if we look at this picture, what we see is the various abdominal organs of the digestive system. Interestingly, where we wear our belt, sort of like coincides to the junction between the upper and the lower abdomen. In the lower abdomen, we have mainly the intestines, small intestine and large intestine.
Yes.
Yeah, and of course for the man would be the
Prostate.
urinary bladder and the reproductive organs for the female as well. In the upper abdomen, as you've just mentioned, stomach, gallbladder, liver, even the horizontal part of the colon, the transverse colon, and behind the stomach, the pancreas, they're all packed together. So if any of these organs were to have any condition, pain felt by the patient may be in the same area, and they call that the gastric pain or the gastric area. So the patient may believe that they're having a pain in the stomach area, therefore it's a stomach pain, when in fact the pain might have come from any of those organs we mentioned. Having taken the story, it sounds like the pain comes on about, let's say, 2 hours after a meal, which is pretty typical of a gallbladder problem or a liver problem. Then if we suspect that in that person, the most likely cause is gallbladder stones, then we would choose the ultrasound, where the ultrasound would examine solid organs very well, such as the liver, the gallbladder with the bile juice inside, and if there are stones within the gallbladder, they will be clearly seen by the ultrasound. If there's a bleeding from the stomach, the patient may notice that the color of the stool to be very black, and in fact very strong odor as well. Bile juice is very important for digestion, and it is a main contributor to the color of our stool. So if the bile juice flow has been interrupted or in some way affected, then the patient may notice that the stool is no longer the normal color. In fact, it looks very pale. Some patients would describe that as a
white stool.
Yeah, clay color stool.
Oh, I see.
So each of these is a kind of what we call imaging modality, and each would have its unique characteristics that would study the tissues of the body. So ultrasound uses sound waves to penetrate the tissues and seeing the reflection of the waves. Same with CT scan. It studies the texture of organs and tissues very well. Similarly for MRI, just that the MRI does not have radiation. This is the upper abdomen, where the ultrasound is examining the gallbladder as attached to the liver. So skin level, muscles level, and then the sound waves has reached the liver and the gallbladder area. So in this particular illustration, what we are seeing is how the radiographer has found the stones in the gallbladder, and they have actually put markers on to measure the size of the stones. And if we examine the patient, we find that, hey, maybe there's actually a gallbladder that's really swollen, raising the possibility of a more complex problem. That's when we will move on from the ultrasound to a more detailed study of the whole biliary anatomy. Usually for this biliary system problem, we prefer the MRI. It's called MRCP. So this is the MRCP that I've just mentioned.
I see.
MRI is an amazing modality to image tissues, and there are all sorts of settings. But for MRCP, we are focusing on the bile flow system, the biliary system. So in this case, we are not seeing the blood vessels or much of the structure of the liver, but what we are seeing is how the bile is collected from the various parts of the liver into a main drainage system.
So all this white thing is the bile?
Bile, yes, right. If the suspicion is strong enough, some doctors will go straight to MRCP or MRI without ultrasound. So in this case, what we are seeing is that the gallbladder with the bile juice inside has many shadows, which
ones,
that's right. Yes, the black ones, the shadows which are not white. Therefore, these are actually filling defects, as in parts which are not occupied by the bile juice, and these are the stones. And some of the stones have gone through the connecting duct and then drop into the common bile duct. And imagine if the bile does not flow, that's how the patient may get yellowing of the eyes, jaundice. It is possible that some people may have gallbladder stones for many years without having any symptoms.
Okay.
So for this patient, what might have been a simple problem previously of stones only in the gallbladder
Now
is
become
now
a
become
bigger
a problem.
problem.
There are two problems, in the bile duct and in the gallbladder. There are many ways to clear the common bile duct or the bile duct of the stones. A much preferred way by many specialists would be using the endoscopic method called ERCP. Yes, which you're familiar with. Yes.
I see.
This patient actually had pain, felt in the stomach area, and having trouble eating, feeling full rather easily. The complaint was that only half amount of meal could be finished. And the last thing that brought the patient in was the patient noticed the stool color to be very black, as black as the hair. That was the alarm that brought the patient to the hospital, and blood tests were done. Examination found that the patient was quite malnourished, and later on the patient went for an endoscopy. The suspicion was that there must be something seriously wrong in the stomach. So in this case, what was found was a large ulcer in the stomach on the endoscope, and this ulcer looked rather so-called nasty. Yes, suspicious. Yeah, of course, the biopsy returned a diagnosis of cancer, and as part of the study of the cancer and whether it has spread, therefore in a way staging the cancer, this patient had a CT scan, and in this case, what is shown is that where the stomach should normally be thin and flexible, what we are seeing is actually a very thickened tissues, and that from this X-ray it could look as if that there's no possibility of the food going through anymore. That the tumor is rather big and, as it were, sort of like almost blocking the stomach. Yes, that's right. Yeah. If this patient had not come in, the next stage would be vomiting after food, which is another very important symptom. Yeah. So this CT scan, you can see how it is able to study the texture of various different tissues. This is fat on the outside. This is internal fat. These are muscles out of the back. This is a spine. Sometimes patients are even given what we call oral contrast. They actually drink something that will light up on the CT scan, and there, very white color, and these are the liquid contrast in the small intestines. So usually PET CT scan is done after a diagnosis is made.
Yes.
Of usually cancer. Whereas a CT scan can be used to make a diagnosis. This is an important illustration of how listening to the symptoms is very important, because sometimes the doctor may decide that there is something not right in the abdomen and something deep-seated. For example, sometimes the symptoms may suggest that there may be a pancreatic problem. Now, pancreas is somewhere between the stomach and the backbone. Unfortunately, for this portion, we only see the tail part of the pancreas. But if the tail portion of the pancreas has a pathology, a disease. The pain felt by the patient could be referred to the front, where the patient may mistake it as a stomach problem. And then would go and request for gastric medicine. Or if the pathology affects the further behind part, or the so-called posterior part, then it may feel as if it's a muscle pain or a kidney pain, and then patient may go ahead and ask for painkillers for the muscles or check their urine. Yeah. So if a person has symptoms that's making the doctor suspect there's something deep hidden inside the abdomen, sometimes the first investigation would be a CT scan.
For straight away to go CT scan.
Yeah, and after the CT scan, depending on whether these tissues are accessible or close enough for us to biopsy, and then we will make a diagnosis. We advise patients to take into consideration the following things. One, age. It is well known that as we get older, our risk of getting cancer is higher. Two, family history, right? Three, the region where we come from. Certain regions tend to have a higher proportion of cancers in certain parts of the body, right? The general advice is actually that if a person has symptoms that don't seem to go away after, let's say, 4 weeks, where most non-critical benign conditions would actually resolve, then it's best to see a doctor and allow the doctor to analyze the story and examine and to decide whether further investigations are necessary. Careful that the diet has to be tailored to the energy requirement and the nutrition requirement of the person.
Okay.
Not smoking is very important. Avoid excessive alcohol. And lastly, do look into the research that is coming out and the result evidence that's coming out in some of the areas that are really exciting. One would be the microbiome in the intestine. Two would be our temperament, mood.
Yes, it's very important.
And lifestyle with the GI health. Yeah,
Yes.
Okay. Yeah.
Thank you so much for your time, Dr. Goh, and for the very detailed explanation about the upper gastrointestinal organs and everything.
My pleasure, Ira.
Thank you.
It's fantastic to have this opportunity to chit-chat. Yeah.